So today I'll be talking about special populations. The first one today is high blood pressure. So high blood pressure is when your blood pressure readings are consistently over 140/90. This puts extra strain on the heart and the blood vessels, and over time it can increase the risk of a heart attack or a stroke. It can be a result of eating too much salt, being overweight, or not being active enough. When training a client with this, you have to avoid taking the hands above the shoulder, getting up and down from the floor really quickly, lying down, putting the feet above the heart, which can all increase the blood pressure to be above normal and risk their safety. Really good things to consider in a training session is keeping the arms below the shoulder height. If you do need to get onto the floor, like doing ab work, doing that towards the end of the session where the client can then recover, and doing a really good warm up and cool down just to make sure that the client is controlling the heart rate and it's not escalating or decreasing too quickly. Our next one today is lower back pain. So lower back pain can be caused by the weakness and tension in the lumbar spine and erector spinae muscles. This can cause discomfort in clients when they're used or agitated in specific movements. This is commonly seen among people who work in a desk job, sitting down for hours a day, or people with spinal problems such as scoliosis, or people with weak core muscles. So when training these clients, you want to look at improving their core strength, such as their rectus abdominis and their transverse abdominis, while not causing pain to the client. So exercises that are ideal in this scenario are ones that look at working these muscles hard and not putting strain on the back, such as like doing things like bird dog exercises where you're on all fours, taking one leg and the opposite arm up, which, you know, you're not putting strain on the back, you're putting strain on the limbs, but you're still working the core muscles. Also things like pelvic tilts and bridges. Last one today is knee injury. So knee injury clients have normally had a pre-existing sport injury, or they've overused their knee muscles, they've had damaged ligaments, or the surrounding muscles are weak, such as your quadriceps, your glutes, which runs off the ITB band, which then connects to the knee, as well as the patella tendon, which is really important in stabilising the knee as well. Exercises such as squats and lunges, or anything that's weight bearing and causes the client to extend and flex their knee, can be quite painful to the client. This is generally because it's all weak around there and they're really not stable with it and can cause them some serious injury. So when training the clients, you want to look at strengthening all the surrounding muscles, such as the quadriceps, the hamstrings and the glutes, while doing this where they're not bearing weight on the limb. So really good exercises could be knee marching, where you're sitting in a chair and from the hip joint you're actually lifting up each leg. This strengthens the quadricep tendons, as well as possibly doing leg curls. This can be done without weights to start off with if the client has a really bad knee injury. Otherwise it can be done in a leg curl machine or a leg extension machine.